Hi, I'm Greta Mah, pharmacist and coordinator for North York General Fanny Bernstein Living Well with Parkinson program. Today, I'm going to talk about medication for early stage Parkinson's. So I'd like to share my screen with you. Okay. All right. So all the information that I share is based on the Canadian guideline for Parkinson's disease, and you can find that in the Parkinson Canada website as well. So how does Parkinson's affect our brain? So the brain cells located in the midbrain, as you see in my cursor, this purple area in the area called substantia nigra, that actually just mean black substance. So these brain cells are responsible of making dopamine. So dopamine is a very important brain chemical to send signals through the body. So by the time we notice our Parkinson's symptoms, so which is three S's, the slow movement, stiff muscles, or shaking, known as tremor, more than 50% of these brain cells are already affected. So the next question people always ask is, when's the right time to start medication? So now knowing more than half of these brain cells are already affected, so your doctor would do thorough assessment and see how serious your symptoms are, like whether the stiffness is affecting your range of motion, causing pain, or your balance or gaze being affected, increasing your risk for fall. So the doctor would advise you, and also based on how you feel. Usually, we don't want to wait too long because it may affect your confidence. So we want the medication to help you feel normal so that you can start joining exercise program, especially with a group to delay Parkinson progression and also to prevent any social isolation. So we have three groups of medication for initial treatment, and they're levodopa, dopamine agonists, and monoamine oxidase inhibitors. So levodopa by far is the most effective treatment because it's the only medication that actually becomes dopamine in the brain. The side effects is due to presence of dopamine in the body outside of the brain, causing drop of blood pressure and dizziness and also nausea. So usually the doctor will ask you to take a small dose, like half a tablet, twice or three times a day, and then gradually increase to one pill three times a day. The main drawback for levodopa is the short duration of benefit. So that's why people need to take it three times a day and even more at later stage. Dopamine agonists only mimic dopamine, so therefore it's not as effective. It's associated with a lot of side effects and especially increasing the mental confusion. So it's not recommended for someone older than 70 years old or someone with risk for dementia. It can also cause a sudden sleep attack. So when people start this medication, the doctor may advise you not to drive or operating a dangerous machine in case someone feel very drowsy initially. And the other side effects that's very troublesome is the impulse control disorder, which is someone who have trouble controlling their compulsive behavior, even shopping, gambling, or even watching pornography, hypersexuality. So family need to be aware of the possible side effects before having someone start on this medication. And the third one is the monoamine oxidase B inhibitors. Even though it's the least effective, it has a very different mechanism. Like instead of adding more dopamine to the brain, this medication help to retain dopamine in the brain. So sometimes the doctor will use this along with the levodopa to enhance the benefit. Side effect is very mild and usually some dizziness from low blood pressure. So that's why I put down resergiline. We recommend to take it in the evening because most people tend to have lower blood pressure in the morning. And the other medication within this group is sertraline. It need to be taken twice a day. So we put down AM and noon time to avoid nighttime dose because sertraline can become amphetamine in the brain and causing stimulation affecting our sleep. And sometimes the doctor may prescribe anticholinergic medication for younger individual if the tremor is very bothersome. So trihexyphenidyl or benztropine are the two common ones, but they have no benefit for stiff muscles or slow movement. And in fact, tremors sometimes get worse when we get nervous or under stress. So it is important to do some mental relaxation or breathing to reduce stress. And then we found the tremor instantly um, get reduced. So instead of relying on medication, we encourage people to use a different strategy, or such as using a heavy pen or cutlery and rest the elbow on the table to minimize the tremor. So the side effects, such as like memory impairment or mental confusion, is very disturbing, especially for seniors. So we definitely don't recommend this medication for older individual, but it can also cause dry mouth and trouble with urination or bowel function. So these medication, as I mentioned, we try to minimize the use, and also, if it's used together at the same time with levodopa, it can affect the levodopa absorption because it delays the time for levodopa travel from the stomach to the small bowel for absorption. Can my diet affect how well my medications work? So basically, all the levodopa depends on, um, doesn't matter what formulation it is, they are all affected by having a meal in the stomach or protein. So uh, we should avoid having meal before having levodopa. But this interaction is not affecting other group of medication. So it's okay for dopamine agonist or resergyline to be taken after a meal with protein. So what's the all the big fuss about levodopa and food? So I like to show this diagram. So when you have a big meal like your bacon and eggs that has protein, so with all the food in the stomach, with your levodopa, obviously it would take much longer for the pill to travel to the small bowel. That's where the medication get absorbed. So it's not absorbed in the stomach, but absorbed in the small bowel. So it's better to have it on empty stomach, so which is half an hour before a meal or 2 hours after, because it takes 2 hours for our stomach to empty a full meal. And also, levodopa and protein share the same transporter. So they need a transporter to carry the medication across from the small bowel to our bloodstream in order to get to the brain. So if people have nausea side effect, instead of having a full meal, we can take it with a couple crackers or fruit without affecting the absorption. I understand sometimes people may have trouble swallowing the food tablet, and if we need to crush the pill, we can mix it with applesauce, but not protein supplement or yogurt because all these have protein. So when the doctor say take the pill 3 times a day, when's the best time to take it? Should I spread it out like every 8 hours, or when's the best time? So interestingly, our brain just needs dopamine during the waking hours. So when we're sleeping, we don't need as much dopamine. So the best advice will be to take the first dose as soon as you wake up, and then the second dose is about half an hour to 1 hour before your lunch, and the same time, um, half an hour to 1 hour before your dinner. When people start to feel stiff or slow movement during the night, your doctor may add a control release tablet. So this allows you to have a little bit of dopamine through the night so that when you wake up, you're not as stiff. So what should I do if I forget a dose? So in fact, there's a study found more than 60% of people don't take the levodopa on time. So that really affects um, the benefits of the medication. So the best advice is to have your pill organized in a weekly pill box or have your pharmacy blister pack your medication and then set your alarm on your phone for the dose that you tend to forget. So we all need some reminder to make sure we take the dose on time. And the other question that people tend to ask, will my medication stop working or become less effective over time? Should I save levodopa until my symptoms get more serious? So the truth is your medication always work because they will always supplement dopamine to your brain or keep dopamine in the brain longer. But after years of Parkinson's, with the disease progression, our brain doesn't make enough dopamine. So we have to rely on the medication more and more over time. So the doctor may gradually need to increase the dose or give it more frequently. So I hope you find this helpful to manage your early stage of Parkinson's.